Hi, Lily. Sorry, you here for the event? Yes. Yeah, I just took the doctor. Yeah, no worries. Take a little seat wherever you find safe. Which will work better for that. Yeah. And we'll have teas and coffee.
Yeah. Hi, welcome to class one. Is the first time?
Yes, first time here.
So yeah, you can pick only the seats for now where we are set up. So which is the best?
Amazing.
Whatever set up, you can pick it. Speaker's gonna be here. So we have gluten-free brownies, so my caramels, and also vegan banana bread.
Amazing.
Yeah. Plant-based banana bread and gluten-free brownie. The tea we are going to the classic, which is beauty, good for skin.
Oh,
It's an infusion. I'm gonna bring it to you. Huh?
thank you so much. Okay. All good?
Just the speaker. The speaker on.
Yeah. So what did you hear about the event? So my friend heard about it. Let's just start checking it out. Heading towards that things. Nice. Yeah. Right there. Yeah. It's out there. Yeah. You ready for it? Yeah. Kind of. Are you from the local area? Yeah. Yeah. Are you some big fly shop before? No, but I've heard about it. I looked it, so. Oh, okay. What is the refresh? Hear about these. Is it sort of pop their heads? Yeah. Yeah. That's what you want to talk about. Yes, thank you. Great. Yeah, it's a lot of things. Yeah, great.
Hello, welcome everybody. Ready to begin? You're all ready? So welcome to our event, Peri-Menopause and Menopause. We've got two excellent speakers today. We've got Jenya Di Pierro. She's the founder of those who don't know Cloud 12. We formed in 2018 and we're a centre of well-being and excellence, whether that's from the kids club downstairs and community and building, playing with families and being together, or whether it's this level. We've got a hair salon through there. Those that don't know, we have a beautiful spa through there with a Himalayan salt chamber, steam room, what else? We've got sauna, ice bath, relaxation lounge, and guided meditation. It's been bespoke made for this environment. We've got 6 treatment rooms. Then upstairs, we've got our wellbeing clinic. Oh, the head, yes. We're quite unique that we're the only place in London, in fact, I think only Manchester has a live flat head spa bed, and we've got 2. Originally sort of from Korea, and it's a beautiful treatment if you've not tried it for your scalp and hair. So thank you.
So, Jana, in the interest of full disclosure, we're not the only place in London anymore. Because I'm going everywhere trying just to make sure we stay on top of the treatments. But we are the only place that has 21 protocol, like 21 step combining, wellness, all of our knowledge as naturopath, a little bit of biohacking. So we still stand out, but the beds are yeah, I'm keeping an eye on the competition.
And then upstairs, vetted practitioners, they do everything from, well, you understand about Dr. Mona and her DP and her practice and what she does. Jenya with her naturopathic, somatic healing and herbal medicine. A lifetime of study, so probably a lot more than I've already covered. We have physiotherapists, we have caloric hydration, acupuncture, many, too many to mention right now. But we also have our biohacking lab. We'll talk a little bit more about longevity and biohacking. Without further ado, let's pass you on to our speakers. So first of all, we're going to go with Dr. Mona.
So Dr. Mona is our GP. So we've got some doctors, not just kind of naturopathic doctors. And I think the future is integrating the 2 approaches. So we'll hand over to Mona to introduce herself and start this talk.
Lovely. So very nice to meet you. My name is Dr. Peri-Menopause and I'm a GP. So I'll just tell you a little bit about myself. So I trained at King's College London, and that's where I got my medical degree. While I was at university, I actually did a BSc in maternal and fetal health. During my medical training, I went to South Africa and I worked in one of the 2 large hospitals in Cape Town, and I did obstetrics and gynecology. When I was there, I did actually quite a lot of gynae cancer, but general obstetrics as well. I started off as an obstetrics and gynecology trainee in West London before switching to GP training again in St Mary's. That's where I did my training. And since I've been a GP, I've had a special interest in women's health and also lifestyle medicine. I've got a diploma with the Royal College of Obstetricians and Gynecologists, and also a diploma with the Sexual Reproductive Health faculty. I've also done my British Society of Menopause, Principles of Menopause Care, and also I'm doing some further training with them as well. So prior to setting up my private practice, I still do work on the NHS in Notting Hill, a little bit in Kensington, Chelsea, but mostly in Notting Hill. So I still do a bit of work for 2 practices in the area, obviously while we build up my private practice, and then obviously I'll switch to that time. So menopause is part of what I do. A lot of my patients will come in generally with their menopause symptoms, or often they will come in with symptoms and they don't necessarily realize that it's menopause. And sometimes it takes quite a lot of time to go through everything and realize what's been going on. I've done a talk that's sort of a general talk about menopause. It's a massive topic, so there's going to be plenty of time later on to go into any sort of specific area, but I've just gone over it very, very briefly, so don't worry, there's going to be plenty of time to go through any questions. All right, so what is menopause? So menopause is So our ovaries naturally produce eggs, and every time we produce eggs, we produce hormones, so estradiol, progesterone, testosterone. As we age, the number of eggs reduce, and therefore we don't produce those eggs anymore, and the hormonal levels will reduce. And eventually, as you can see in the perimenopause period, they're starting to gradually reduce. And then once you hit menopause, the levels will be plateaued and they will be reduced. The average age of menopause in the UK is 51. The definition of menopause, so if you're under the age of 50, the definition is if you've not had a period for 2 years, and above the age of 50, if you've not had a period for 1 year. So those are the technical definitions of menopause. The average age of perimenopause tends to be 45. So this is quite a nice graph, and I quite like to use this because in the reproductive years, so you can see every single month you will have these fluctuations in your estrogen, progesterone, which occur because you're ovulating, and they're there to create an environment to release the egg, and then an environment in which if the egg were to be fertilized, it would be a nice environment for it to implant. And then we get to the perimenopause stage. So this is the stage that is before menopause, and this can vary in different people. So the average age of this is around 45, but we do know that women can have perimenopause for 7 to 10 years before they actually become menopausal. And I think this is often the period in which things can be a bit more confusing, because a lot of the time women might present with symptoms, but they might not necessarily think that it is perimenopause. So for example, say you're going to have menopause at the age of 50, you might actually start having some symptoms at the age of 40, but at that age you might not necessarily think that these could be perimenopause symptoms. So I think a lot of the time that's the period in which people come to see me and we try and figure out what's going on. In that perimenopause period, often what happens is your periods can become quite irregular. So they either become more frequent, less often. Some women get very heavy bleeding leading up to the menopause. You can also get any of the symptoms of menopause during that time as well. So, perfect. All right. So, menopause or hormone deficiency. So a lot of the time people will say, oh, you'll just go through menopause and then everything will be okay. With menopause, the hormone levels will be reduced and they're not going to return back to normal. For a lot of women, they will get symptoms, and then after that, the symptoms might get better and then they'll be absolutely fine. For other women, they will have these ongoing symptoms and it might not necessarily improve. So it's not always a period that you sort of transition to and then everything's okay. For some women, they will have ongoing issues. So symptoms of menopause. So the most common symptoms, and the ones that we probably know about it more commonly in the media, are what we call the vasomotor symptoms. So that's things like hot flushes, night sweats. Other symptoms that are really common are things like mood swings, fatigue, a lot of disturbance with sleep. So often women who've never had any sleep issues will then start complaining of, not being able to sleep or waking up in the middle of the night. They can often have poor concentration, lack of libido, heavy periods, particularly in the perimenopause phase, muscle and joint pain. So that's a really interesting one, because often I will see a lot of, for example, women coming in with things like frozen shoulders. So that's actually quite a typical menopause symptom. And often women won't have had any sort of joint issues at all. And then their first presentation will often be around the time of the menopause, because female bodies, we have estrogen receptors on every single one of our organs. And when we go through that period and the estrogen reduces, it can affect absolutely any part of your body. And everybody's body is very different, and we have different sensitivity to our receptors in different parts of our bodies. So often that's why we all individually present with very different symptoms. Women will also report hair and skin changes. So often they'll get hair loss, they'll get dryness of their skin. Even I've had women who've suddenly had itching, and you do all these investigations, you find absolutely, no issue with their skin. And then often you start them on hormone replacement and their itching completely goes away. Depression, anxiety, and irritability. So obviously depression and anxiety is quite common anyway. Women will often tell you that they feel very different. So they'll say, I'm feeling really anxious, or I'm feeling really stressed, but it's not like previous anxiety and depression that I've had before.
So I think it's really important to listen to what the patients or the women's telling you, because they will be able to tell you whether it's different to something that they felt before. I think one of the main issues, I think, with general practice and the lack of knowledge with menopause is that often you'll go to see the doctor, you're around 50, you'll be saying, oh, I'm feeling a bit anxious, I've got a bit of depression. And very often people will start you on antidepressants when actually we're not really exploring the other reasons and whether actually, this is a woman who's like totally fine. And now she's suddenly got depression, anxiety. And actually, if you explored it, you would see that, yes, maybe her periods are becoming irregular. There's nothing else really going on in her life. And actually, could this be menopause rather than anxiety and depression by itself? Memory problems. So the really, actually, I'll get into that in a second. Panic attacks, which often, they'll say they've never really had them before. Worsening headaches, sometimes migraines can get worse. Women who have PMS can often find, so premenstrual syndrome, can often find that things get worse, particularly in the perimenopause period, where their hormone levels are fluctuating a lot. Vaginal symptoms are very, very common. So we get less production of estrogen to the vaginal tissue, so the area becomes very dry and irritated. That also can lead to urinary symptoms. So because that area is not nicely lubricated, it doesn't have a natural protection, natural barrier. And so therefore women can often have more urinary symptoms. So they can get recurrent urine infections when they never used to have them before. And they can also have more sort of overactive bladder. So they're more irritated, they're passing urine more often. And sometimes these can be improved a lot with vaginal estrogen, which we can go into. Dry eyes, sore mouth. So basically any symptom. So I was doing a similar presentation for corporate organizations, and I was actually looking at the effect on menopause and work. And I thought I would just bring it up because I thought it was quite interesting. So the ways in which menopause can affect work. So obviously anxiety, brain fog, I think is a really, really interesting symptom. So we have a lot of estrogen receptors in our brain, and there will be some women who are very sensitive to the sudden drop of estrogen in their brain. So most women who are going through menopause will have some element of brain fog, and that's often quite mild. So for example, if you gave them a shopping list of 16 items, they might forget one item, whereas they might not have forgotten that before. There'll be 10% of women, however, who do have a significant amount of brain fog, and that can often last for quite a period of time. And sometimes it's not necessarily reversed. So women who are less at risk of this are sort of middle to upper class, they have good nutrition, their weight is good, they're exercising regularly. So those tend to be very protective factors. So that's, I think, a really, really interesting one. Fatigue, lack of confidence, lack of self-esteem, embarrassment and inconvenience of the physical symptoms. Women who come to me often will say, I have literally never ever had any problem with working, like at all. And then suddenly they will be unable to do things that they've always done, right? So they've led, you've got like lawyers, you've been doing all these things, and then suddenly they'll come in and they say, I can't even do this simple task. It's all, it's so unusual for me. So again, really important to listen to what the patient's saying to you. So the Newson Clinic did a really interesting study. So they had 3,800 women and they asked them about work, and 99% of them reported that perimenopause or menopause actually had a negative impact on their work, which is massive. And I put this up because I thought it was quite interesting. So 59% of them had taken time off work due to their symptoms, which is a lot. And 18% had actually taken more than 8 weeks. 50% of those resigned early or took early retirement because of their symptoms. 21% didn't go for promotion, 19% reduced their hours, and 12% even resigned. And they reported that the reason that they'd taken that time off was because they didn't feel as efficient. They felt the quality of their work was poor and their concentration wasn't very good. So that's absolutely massive impact that it's having. The other thing that I think is really interesting is that the reason for these sick notes. So only 5% of them had menopause written on their sick notes. So that's something that I always go through with patients, and I will always encourage them to put down menopause. And the reason I think that's really important is because I think as an employer, it's very useful to know what the reason is. So if you're having a lot of women coming and they're having menopause symptoms, it's going to highlight to you as an employer that maybe you need to put things in place to support those people or think about the way in which they're working. So, but obviously very much with sick notes, it's your choice what you share with the employer. You don't have any, you don't have to tell your employer exactly what's going on. The other thing that was interesting, over a third had a sick certificate that actually, for menopause symptoms, that actually said anxiety or stress. So again, a lot of the symptoms are being put down to anxiety and stress. Only 25% of them had their hormones even discussed with them by the doctor, which is really, really low. 30% of them were given antidepressants, and 60% of the workplaces offered no support for menopause at all. So quite significant. All right, so I'm going to go through hormone replacement, which is a massive topic. So I'll just go through it briefly, and then we can go through it a bit more in detail later. So hormone replacement involves the replacement of estrogen, progesterone, and testosterone. There are many different preparations of hormone replacement therapy. So you can have vaginal estrogens, you can have estrogens in the forms of patches, gels, spray, tablets, and then progesterone comes generally in tablets, or you can have a combination patch or tablet, so that's got estrogen and progesterone. And then we have the Mirena coil, which is a progesterone-only coil, which we can use as part of the hormone replacement, the progesterone component of it, and then testosterone. So is hormone replacement safe? So I think that this is a really, really important topic to go to, and part of the reason that I think women have struggled a lot with menopause is because of the way that we sort of approach this question. So previously in the 90s, women were being prescribed hormone replacement therapy with no sort of issues. And then in the early 2000s, a study came out called the Women's Health Initiative. I think it came out in 2002 or 2003. And that study had recruited women to explore the risks of hormone replacement therapy. The issue with the study was the average age of the women that were recruited was around 63. So that's much older generally than the age that women normally would start hormone replacement therapy, which is around 50 to sort of 59. And they were also given a combined tablet of hormone replacement therapy. And back then they were using equine estrogen, and they were also using a synthetic progesterone. And the results of that study showed that there was an increased risk of breast cancer. And then obviously the media took that study, and then there was a lot of news that said that hormone replacement wasn't safe. There's a lot of fear among practitioners and also patients, and therefore a lot of women stopped hormone replacement therapy. And it's only been recently where we've really looked at the data, and a lot of influential people like Davina McCall and Dr. Newson have done a lot of work around re-educating women about the safety of menopause, that we now are in a much better place. And should women choose to start hormone replacement therapy, there's a lot more information and a lot less fear around it. All right, so that one. So breast cancer risk. So I think that's the main thing that people often get quite worried about with breast cancer risk. So the reason that I put up this chart is because breast cancer risk is a relative risk. So we all as individuals have very different breast cancer risk, which will come from our genetics, our family history, the way that we choose to live our lifestyle. So all of us will have a different risk, and that risk will change through our lifetime depending on what we do and what we use. So let's do this. So the study that I was talking about, the Women's Health Initiative, said that there was an absolute excess risk of 8 more breast cancers per 1,000 women in this age group when using the combined hormone replacement for 5 years. And the reason I brought this up is because actually, if you look at the increased risk of breast cancer in people who are overweight or obese, actually that risk is quite high. Yeah. So yes, there might be a very, very small increased risk of using hormone replacement therapy, generally over 5 years, but it is actually similar to also being overweight. So generally, it is thought that if you use hormone replacement therapy around the time of the menopause, the relative risk, increased risk, is very small. And actually, sometimes the benefits of it are increased because it does reduce your risk of getting things like endometrial cancer. We know that with breast cancer, the risk is duration dependent. So the longer that you're on breast cancer, the longer that you're on hormone replacement therapy, the more it increases the risk of the breast cancer. And a lot of that risk also comes from the type of progesterone that we're using. And we'll get into that more in detail in a second. But for example, with this combined hormone replacement, they're not using a progesterone, like a natural occurring progesterone, they're using more of a synthetic progesterone. So, and actually the other thing to point out is, whilst there might be a very, very small relative increased risk of breast cancer, there is no increased risk of mortality, so passing away from the breast cancer. So that's a really important thing to highlight. I'm just going to sort of go that one because that was a bit confusing. So other risks, so blood clots. So we know that there's not an increased risk of having blood clots when you're taking the oral tablets. And the reason for that is when you take the tablets orally, it's broken down by the liver. And then there are some byproducts which are produced that can increase the clotting. But we do know that there's no increased risk with using gels, patches, and creams. So that's very good to know. And estrogen is generally protective for your heart. So we do know that when women go through menopause, they have increases in their cholesterol levels, their heart rate increases, their blood pressure increases, their body becomes more resistant to insulin because we're moving away from a female physiology a bit more to a male physiology. And we know that estrogen is very protective for us. So it's very uncommon or less common to see younger women having heart attacks or even strokes because the estrogen is there to help protect us. So there's no increased risk of heart disease when hormone replacement therapy is started under the age of 60. So that's very good. And then stroke. So there is a slightly increased risk with the oral tablets, but we know that there's no increased risk with the patches, gels, and creams. And generally, women under the age of 60 have quite a low risk of stroke compared to men. Right. So a really interesting topic. So I'm going to go a little bit into bioidentical hormone replacement therapy. So there's two components to that. And the first component I'm going to call body identical. And that's what we call regulated bioidentical hormone therapy. So just to go through the different hormones. So we as women have 3 different types of estrogen. So the main component of estrogen in our body is estradiol, and that's produced by the ovaries. And that's the type of estrogen that is in all the body identical hormone replacement therapy. We also have estrone, which is a much weaker form and in smaller quantities, and the main type of estrogen that occurs after menopause. And the third type is estriol, which is generally produced sort of during pregnancy, and it's made by the placenta. And then we have the naturally occurring progesterone, so the one that our body makes from the ovaries and the placenta. And then we have synthetic progestins. So this tends to be the progesterones that are in the combined in the contraceptive pill, but also in the combined hormone replacement therapy. And then we've got a couple of other hormones and enzymes, but we won't get into that too much. So what is body identical hormone replacement therapy? So that is hormone replacement therapy that has estradiol, and that comes in gels, patches, or sprays. And then the most naturally occurring form of progesterone is micronized progesterone, which is also called Nutrigestan. And all of these are made naturally from like soy and yam plants. So here's just a list of the different hormone replacement therapy preparations. So the first ones are the body identical. So these are estradiol, and these are a couple of different brands. So Estradiol and Everol patches. Estrogel is a pump gel. Sandrena is a gel that comes in a little sachet, and Lenzetto is a spray. And then we've got the Utrogestan, which is the tablet form of progesterone that's most similar to our natural occurring. And then we've got a combination of combined progesterones and estrogens. So some of these are patches, and some of these are tablets. So these will have estrogen, and particularly the progesterone won't be similar to the estradiol or the micronized progesterone that we naturally produce in our bodies. And then we've also got vaginal preparations of estrogen. So we've got, there are creams, pessaries, or even rings that you can use. And they work very locally to manage the symptoms of vulval dryness or urinary symptoms as well. You can use, and I very often do use, vaginal estrogens with oral or patch systemic hormone replacement therapy. So micronized progesterone, so progesterone that's most similar to our body, we know that it's got a neutral effect on cholesterol and sugar metabolism. It doesn't increase your risk of having a blood clot, and it's associated with the smallest risk of breast cancer compared to other progesterones. And then the other group that I wanted to go into was the other form of bioidentical hormone replacement therapy, which is called conjugated bioidentical hormone replacement therapy. So this is often offered by certain private clinics, and might be a little bit complicated, but we know in the body that the different estrogens are competitive inhibitors of different receptors. And some people have interpreted that to be that we do need a bit of estrone to balance out the other two forms of estrogen. And as a result, they have created what is called, what everyone thinks bioidentical hormone replacement therapy is, which is biased, which has got estradiol and estrogen in it, and then triest, which has all three forms of the estrogen in it. Often these are also compounded with progesterone, testosterone, and DHEA, which is another hormone. So the issues with this is that they're not actually regulated. So with all other medication, they've obviously gone through trials, testing, and safety, and we know the effects of them often through massive trials. But the problem with these hormone replacement therapies is they're often made in small clinics and pharmacies. They don't meet regulations, and we don't quite understand the true consequence or effect on them because they're just not quite regulated. Some of the issues with it are often they will have progesterone. They come in creams, lozenges, or vaginal preparations, and the progesterone will often be in that format. We don't know whether the absorption of progesterone through the skin is necessarily going to be good enough, so we're not sure whether this the compounded bioidentical hormone replacement therapy is enough to protect the lining of the womb. So I think we need a lot more studies and trials around this to see what the effect of it is and the safety of it. What I think is really important to highlight is we know that the combined hormone, we know that different preparations of hormone replacement therapy can have different risk profiles. So I think when we're advising women about hormone replacement therapy and even prescribing it to them, we have to be quite confident and really know the research and data, because there can be quite a big difference in the risk profile from different hormone replacement therapies. So it's something to be wary of. A lot of private clinics will also do a lot of expensive saliva tests and blood tests, particularly estradiol. We know that you will have different women who will have similar estradiol levels, but they will present with very different symptoms. So there isn't always a strong correlation between the estradiol blood test results and the woman's symptoms. And the reason for that is probably because we all are wired very differently, and it's more about the sensitivity of our body to the hormones rather than the level of the hormones. So when we're adjusting hormone replacement therapy, I will always go based on women's symptoms, because they will notice a big difference in how they're feeling. And often when you adjust the doses of the medication, their symptoms will improve quite a lot. And then the last one I want to talk about is testosterone. So testosterone is a really important hormone. It's very important for sexual function and sexual desire. And often women will report symptoms of low libido. Again, with testosterone, it's interesting because there will be women where you check their testosterone blood level who are going through menopause, and it will be very low, but they won't report reduced libido. And the reason for that might be because a lot of testosterone is converted into the brain, to a different hormone. And some women's brains are more sensitive, so they don't, even if they have a lower level of testosterone, it doesn't really affect their libido or their sexual desire. When I think about testosterone, we always like to address the other hormones first. So we'll always optimize the estrogen replacement. Because a lot of the time when you do that, you find that the symptoms have improved and their libido increases. I'll always talk about vaginal estrogen, because one of the main reasons often women lose their sexual desire is because they get a lot of dryness or irritation down below, which obviously naturally puts them off having sexual intercourse. So if you can correct that with just some vaginal estrogen, which is very low risk and not really absorbed in the rest of the body, then that's an easy win, isn't it? We know that when you take oral estrogens, it can affect the metabolism of testosterone. So often we'll switch women to estrogen through the skin, so the patches or the sprays or the gels. We also know that the side effects of testosterone are excess hair growth, acne, weight gain. But these are very, very dose dependent. So often, if you adjust the dose of the women, then you can pretty much eliminate those side effects. So testosterone is off license. So these are male preparations of testosterone, but we do use them off license in hormone replacement therapy. They come in gels. This cream, I think, has to be, you only get in the private sector, and it's imported, I think, from Australia. And the implants, we don't really use them very regularly, but a couple of private clinics do them. With testosterone, we always check the blood test. So we'll always check your baseline testosterone level, and then we'll initiate you on the testosterone. So normally a really small amount, so an 1/8 a day, which is equivalent to about 5 milligrams a day. We'll recheck your testosterone at 3 months just to see and make sure it's not too high. And then every year we'll recheck the testosterone level. So that's it. I've really gone on and on about the hormone replacement. So I'll hand it over to Jenya and see if there's any questions, if we can go through it later.
Just going to flick through a couple of bonus slides. Oh yeah, that's mine. Just very quickly to introduce myself. So I'm a naturopath, herbalist, homeopath, practice somatic healing. So different shades of naturopathy to support body in the most holistic level, from diet to herbal strategies to supplements to mental emotional work as well. And I'm the founder of this place. So I'll start with this chart very briefly. Mona already showed you similar charts. And in this talk, I want to focus on peri-menopause and menopause and what can you do specifically to balance some of the symptoms. So she showed that estradiol kind of later in life, in your 40s, starts to fluctuate. And so it's a hormone that after puberty sort of raises gradually. And then, you know, these shifts happen, and these shifts actually cause some of those uncomfortable symptoms that she mentioned, but predominantly will be more frequent periods, really heavy bleeds, very painful periods, might result in anemia. Now, this only happens in about 30% of women. So hopefully you won't have to go through this. But if it does, there are some strategies that can help. other symptoms of perimenopause, they really resemble menopause, where you have brain fog, fatigue, and so on, what Mona already mentioned. But actually, the first hormone that starts to drop is the progesterone. And the progesterone is the hormone that kind of keeps us calm and happy. So towards perimenopause, you might experience similar symptoms to PMS. Actually, when you have those low moods and when you have anxiety, and this is because, you know, when we ovulate, progesterone production starts to rise, and then if you don't get pregnant, it kind of falls off the cliff, and that fall off the cliff is where you might experience some of the anxiety and brain fog and the rest of it. And luckily, there are herbal strategies for that as well. So just quickly to go through some of the roles of progesterone that are really relevant to perimenopause and menopause. So like I mentioned, what you would feel the most when it declines is the kind of mental, emotional effect of it on our body. And by the way, we have receptors all over the body, so it's not just the ovaries that are involved. These hormones would affect your nervous system, your cardiovascular health, your musculoskeletal health, and so on. That's why the effects of this shift are so systemic. And more importantly, it also plays kind of a balancing role of counteracting some of the less beneficial effects of estrogen. So estrogen is a proliferative hormone. And when we have that estrogen dominance, we might also have problems with breast health. When you have enlargement, I actually experienced that myself, and you know, proliferation of the tissue, and then that can come with pain and so on. So progesterone is there to balance some of that proliferation, and also to balance some of the kind of inflammatory effects of estrogen. So estrogen, it has both, but predominantly has an inflammatory effect on our body, while progesterone has anti-inflammatory. So the issues start to occur in perimenopause, not just when progesterone falls, but when the relative ratio of progesterone to estrogen changes. So when estrogen sort of rises, or it can even stay the same level, but the progesterone drops, that imbalance is what might be responsible for some of the discomfort that you feel. So estrogen has many jobs, and a lot of them are amazing for our body. It's responsible for our plump skin and beautiful hair. It supports bones health, so preserves mineral density and lows fracture risk and so on. That's why, you know, it's very important hormone for prevention of osteoporosis that may or may not happen during menopause. It also modulates glucose metabolism. So you might know that during menopause, women might also face some issues with insulin, and you know, the insulin sensitivity will drop and insulin resistance will rise, and that would kind of have a cascade on your metabolic health, and you know, might result in also weight gain and you know, blood sugar dysregulations, where you might have also brain fog and fatigue and some of those things. It does also support actually mood and brain function, so because it increases serotonin production. And you might know that a lot of the serotonin is actually produced by our gut. So there's a very strong connection. And we have actually a type of microbiome called estrobolome, so that has relation to estrogen. So it's a group of bacteria that actually produces an enzyme that helps us reabsorb the estrogen from the gut. When it's in overdrive, it's actually not beneficial for us, because again, we will end up with not just too much estrogen, but with a lot of toxic estrogen in the body. But it also plays a very important role to supply us with some of the estrogen in menopause. So these are the main sources of estrogen. In our reproductive years, ovaries are the main organs that produce both estrogen and progesterone. We also produce some of it from our fatty tissue. So, you know, if you do gain a little bit of weight towards your midlife, don't be worried too much, because it will be supplying estrogen. So the fatty tissues in combination with our adrenals, and also ovaries to a little bit of it, to some extent, because ovaries stop producing estrogen and progesterone, but they actually continue to produce androgens like testosterone that then converts into estrogen. So keep your ovaries if you can. You know, some doctors have an opinion that we can easily take out our uterus and our ovaries around menopause because they don't serve any role, but actually everything in the body has an important function. And so ovaries will be supporting a little bit indirectly the production of estrogen kind of late in life. But the main kind of engine there will be our fatty tissue, our adrenals, and our colon that reabsorbs, like I explained before, some of the estrogen. Now we have obviously supply from some pharmaceuticals, xenoestrogens, which are plastics. You don't want any supply from that channel, and I'll explain a little bit before why it's harmful. And then our lovely 5 estrogens, which is actually the best thing you can do if you want to manage your menopause naturally. Nature has given us lovely plants for that exact reason, and they can actually replenish it to the extent that you won't need to rely on medication. However, I'm not anti HRC. I do believe that it always has to be bioidentical. So when you can consider that option, always focus on bioidentical, because that really has almost no risk of cancer. And I was actually really happy to learn from Mona that NHS also now predominantly prescribes bioidentical hormones, which is like really great news for women. And the synthetic ones, those progestins and other things that she mentioned, they do bear a lot of risks. And also they act a little bit different in the body to your natural hormones or to the hormones that are found in nature. So now I really want you to memorize this chart. I'm joking, but what I want to explain here actually is estrogen metabolism, because we don't have just one type of estrogen. And Mona mentioned 3 main types, but actually they metabolize to a lot of other estrogens. And you can see on this color code that some of them, the red ones, are actually toxic and dangerous for us. So these are the estrogens that are responsible for unwanted growth, you know, your fibroids, when you're in reproductive years, this will be endometriosis, adenomyosis, those kind of things, and also cancer, right? So you don't want too many of those in your body, and I'll show you the test in a minute that can sort of identify how your body is working and what pathways is pushing down your estrogen. And this is, you know, when Mona also mentioned you might have normal estrogen levels, but women feel very different symptoms. This is because all of those metabolites can be in overdrive, even if your estrogen is normal or low. So you can be still experiencing proliferative effects of estrogen while looking at your blood test and thinking, oh, my estrogen is low, what's going on? So I believe it's really important to check that if you're considering hormone replacement therapy, because you'll be taking on drugs and you need to know whether your body is metabolizing them towards more protective estrogens or more proliferative estrogens. And actually, there are cases where women go on HRC. So many, 15% of women in reproductive age suffer from adenomyosis, endometriosis, really uncomfortable symptoms, heavy periods of pain. And then they're kind of waiting for menopause to be free of that. And then menopause hits, they go on HRT, and then the whole thing starts again. They start feeling all of these uncomfortable symptoms of estrogen dominance, as we call it in naturopathy. So there are tests to check for these, and you really want to kind of stay away or have proportionally lower red estrogen metabolites, and then focus on more healthier ones. And then also, I guess, one important point here, you can see that the starting point for all of this hormonal production of your reproductive hormones is cholesterol, right? So that means that please don't exclude fats from your diet. Focus on good fats, but don't exclude them, because they make very important hormones for us. And that also means that statins will massively impair that production. So for me, it's quite a risky drug, and you need to consider very, very seriously, you know, if you need to take it for normally the reasons of high cholesterol. But there are herbal strategies and naturopathic strategies that I think everybody should first consider, because these statins are not without side effects. Okay, so that's the test that I mentioned. So it's called Dutch test. Again, don't worry about all this complex charts here. But this is actually a urine test. So it's done by in functional medicine, kind of naturopathy. Less so. Well, I don't think NHS will never test for it. It tests just for your headline hormones in terms of doing a blood test. So this one will look at all of your reproductive hormones, but also there is another part of it that will look at your stress hormones, cortisol, and so on, and its cycles throughout the day, which is very important because stress and cortisol rising in menopause also can cause a lot of dysregulations in the body. And so what's important here is these pie charts and the proliferative and sort of carcinogenic estrogens. These are the blue one and the red. So it's important that it will be proportionally less than our lovely 2OH estrogen, this green pie chart. And so the test will check proportions of estrogen metabolites and which ones are proliferative and which ones are carcinogenic. I think it's a very good test to test for everyone. Women who suffer with endometriosis and this estrogen dominance, so even before menopause, in perimenopause as well, when things get a little bit heightened, it's very good to know what is going on, because this conversion happens in the liver, and there is a lot you can do to support your liver function with herbs and supplements. So if there is an issue, you need to know about it, and then you need to implement herbal and other naturopathic strategies to push it down the green pathway towards 2OH. And as I said, I think it's very, very important to just have a check before you consider hormone replacement therapy. So some of the herbal strategies for perimenopause, but like I said, a lot of symptoms really overlap. So I think the symptoms that are unique to perimenopause, like I said, those heavy bleeds that might result in anemia. And so you will need some blood tonics, and then you might experience a lot of pain. So there will be herbs that will support period pain, and also herbs that will support liver function to kind of reduce the estrogen dominance. So basically, those three will apply to perimenopause, and the rest will help through both of these stages in your life. So 5 estrogens. It's a really clever group of herbs. Actually, you're going to get it in your tea today, menopause tea, which has red clover. What other 5 estrogen does it have? Sorry, I don't remember all my herbal formulas. But sage, yeah, that's the other one. So, herbs come in form of roots and leaves. So we're quite limited where we can use it in tea, because if it's roots, you'll have to boil them to extract the active ingredients. So, with teas, we mainly use leaves. And in the plant world, we've got red clover and sage as our 5 estrogens. And like I said, 5 estrogens are clever. If your estrogen is an overdrive, it will bring it down, because it's a weaker form of estrogen, so it will bind to the estrogen receptors, and it will kick out more toxic estrogens. So overall effect will be modulating. And then, of course, when you're lacking estrogen, it will replenish those levels. So it can do whatever your body needs it to do. And herbs are really, really clever like that. And it's quite extraordinary. I don't think we can fully comprehend how clever they are. Then we've got blood tonics, and this is when you have a lot of pain, when you have heavy bleeds. In Chinese medicine, pain is called by blood stagnation. So it's when things are not moving. So you want kind of circulatory stimulants, as well as blood chi tonics, so the ones that build blood and nourish blood. And Angelica sinensis, white peony, and Rehmannia, they do actually both. And you can see that I color-coded this. In naturopathy, and mainly in Eastern, so Chinese and Ayurvedic medicine, it's super important to consider energetics. So, for example, in menopause, your body is kind of overheated, right? You have, you can say, yang excess, how we call it in Chinese medicine, but basically it's a hot condition, right? So the last thing you want to do is actually pick all of these red herbs and make a mix, which is supportive for menopause, but it will overheat your body. So you can even get more uncomfortable. That's why it's really important to think about the balance. That's why I think the specialists will kind of take care of that, where if they have to use a hot herb, they will balance it with a cold herb so that your energetics are taken care of. You can also, of course, have overly cold conditions as well, even in menopause. So everything should be considered. Now, the energy boosters, adaptogens, they're really amazing at keeping your energy up. So when you have that fatigue, you know, that Mona mentioned, many women have to take time off and so on. By the way, I'm of the opinion that if you can, do slow down for a couple of years, because menopause means that you have to pause. And your body, by producing the symptom of fatigue, is actually telling you, just take a break. Let me take care of hormonal shifts and so on. And then you can come back in full strength and launch a new business, start a new career, learn a new thing, whatever you want to do. But just give me a little bit of rest to help you through this shift, right? So it's not always that we feel fatigued. We need to kind of pump our body with some adaptogens. And I actually didn't mention the strongest one, which is Panax, Korean ginseng. So that's an adaptogen that's a real kick. Still not as strong as coffee. Definitely doesn't produce those kind of fluctuations in energy, but it's very heating and very, very strong. Here during menopause, you want to support your body gently. So you want to give kind of more moderate adaptogens, which is Siberia ginseng, rhodiola is slightly on the stronger side, and then Rehmannia. The great thing about herbs, they don't do just one thing. So when you're thinking a variety of symptoms, and for example, find the same problem with the blood circulation and energy, you'll pick Rehmannia because it will do both. It will also, it's a great anti-inflammatory herb if you have joint inflammation like arthritis and so on. So it does so many things. And as a herbalist, you'd look at a variety of different symptoms and try to pick the herb that will tick the most of the boxes in your body. So yeah, adaptogens are great. And it's another clever group of herbs that don't necessarily send your body to into overdrive. They basically modulate adrenal function. So when you're tired, they will support. When you are sort of wired, they will bring you down. And there are different classes of adaptogens. So for example, ashwagandha, it's more on the calming spectrum, but in general, this group is also modulating. So it's clever enough to do what your body needs, and doesn't upregulate or downregulate, and it's not one directional. So pain relief, you know, willow bark is actually what aspirin is made of. But it's much gentler on the stomach and has a lot of protective qualities. And that's what herbs are great for, because 25% of pharmaceutical meds are made from herbs, right? But they've extracted an active ingredient and amplified it to an extent that you get a faster result, but then you can have some side effects on your stomach lining, for example, when it comes to non-steroidal anti-inflammatories. And in this case, willow bark will have various cofactors that scientists will consider useless, but actually play a role to give you a synergistic kind of cocktail of all these wonderful herbal actions. And also, you know, some of those cofactors, they're there to help with the absorption, because herbs are basically food. So sometimes, you know, I was surprised in my career where herbs acted much, much faster than pharmaceutical drugs. And I was like, how can they be better than antibiotics or steroids in terms of really fast action? But this is for two reasons. One, they're better absorbed, so our body welcomes. And then another one, of course, we develop kind of resistance to drugs. So at some point they stop acting. So herbs come in and all of a sudden they do the magic and you're surprised. But they're as strong as steroids or some other pharmaceuticals. So breast health, Vitex is basically hormone balancer, super good for all sorts of reproductive issues, and also this luteal phase, so second phase in your menstrual cycle when you need your progesterone. So when women start experiencing breast health issues because of the progesterone drop, Vitex will do a good job at supporting that imbalance. And then we've got evening primrose. So calendula, red clover here because they are alterative. So they basically cleanse your lymph and help your body get free of toxins, because a lot of pain, a lot of discomfort actually comes from excess toxicity in the body. So using lymphatics will go a long way to support you with so many symptoms you didn't even, focus on them, and all of a sudden, you have more energy, your sleep is better, your breasts are not hurting anymore. So they're really multifunctional in that regard. Castor oil compresses, I'm really a big fan of. If you want to know the brand, come and talk to me after. They help with kind of breast tissue tenderness. Also, they support liver, so they're really great. It's a really great detoxifier for the liver. You can just kind of wrap it around and watch a movie or something. It's really easy to comply. If you do it yourself, castor oil can be a bit messy, so I prefer, some brands who already packaged it nicely. Also great for scarring and any adhesions, even kind of internal, like endometrial lesions and things like that. And then liver support is quite obvious. It's our main organ for balancing hormones, so really important to take care of. Shisandra, it's actually it was one of the favorites of Chinese emperors. So it's great for longevity, it's great for stress relief, and it also supports your liver. It has all 5 tastes, which means so every taste plays a different function. So for example, bitter is draining, pungent taste expels things from your body, sweet nourishes, and so on. So by having 5 tastes, it actually does pretty much everything that your body needs. Barberry, rosemary. Rosemary is great for cognitive health, among other things, and also rosemary is the herb that helps to push estrogen metabolism down that healthier pathway to OH. So it's often in my formulas for endometriosis, estrogen dominance, and so on. And then goji berries, they support liver, but they also great for modulating insulin. It's very fast and a lot. So now there are some herbs also for bone health. For stale, major source of silica, red clover in trials did really well. Nattle has probably most minerals when you compare it to other herbs. Gotu-kola is my favorite beauty herb. It's an our beauty tea because it stimulates collagen production in the body, as well as supporting bone health. So it's a great herb for you to consider kind of later in life. It's also good for cognitive health. So as far as menopause is concerned, gotu-kola should be in a lot of formulas. Horny goatweed, it's actually, well, I put it there. It is good for bone health. It's not the main one, but it's also good for libido, as you can imagine from the name. So I didn't have a section for libido, but this is something as well that can be an issue because in some women, testosterone also falls during menopause. So libido might be a goal. So blood sugar balances, quite a lot of them. Gymnema is actually probably the most potent. It's used in India by people actually who cannot afford insulin, so by diabetics. If you translated it from Sanskrit, it's called sugar destroyer. So a lot of them, I mean, I'd say balances, but they really help bring down your sugar levels in the blood. So they're less modulating in that sense. So nootropics, St. John's, it's a natural antidepressant. Bacopa or Brahmi, that's what Indian monks use to meditate. So it improves focus, memory, cognitive health in general, and gotu-kola already mentioned. Then we've got our sedatives and anxiolytics. So the skull cap is more of an anxiolytic. You can take it actually during the day. It won't make you drowsy or anything like that, but it will help with your sleep if you cannot sleep because of heightened anxiety. So it's not sedative per se, but I use it in a lot of my sleep formulas. Passion flower is more on the calmer side. So I mentioned Shisandra as well. Jujube is amazing. That's actually a sedative. And with Jenya, by the way, that's ashwagandha. That's a Latin name. So I think you know about it. It does support sleep and kind of reduces stress, but it also supports thyroid function, which is another function that can be a little bit weak, and that some fluctuations can happen in menopause. It's great for fertility, immune system, like many adaptogens, plays many roles in your body. Jujube is a Chinese date, so it's different from a Middle Eastern one. It's actually I'm studying Chinese herbs at the moment, and I kind of discovered so many recipes where they make congee and other preparations with all of these medicinal herbs. So I use a lot of Indian herbs, Western herbs in all of my recipes. But Chinese is another level. They put all those beta adaptogens, and I'm just discovering it. But jujube is in a lot of recipes because it's also sweet. It's actually very, very tasty. It's not as tasty as or not as sweet as Middle Eastern dates. But whenever when you make a dish and you need a bit of honey or maple syrup or something to balance the acidity and stuff like that, in China they use it, and actually in Korea and Japan as well, for that purpose. So cardiovascular health, I love hawthorn because it can actually be combined with most pharmaceutical medications. But of course, if you're on pharmaceuticals, just always check. It's quite important to look for interactions. Gugulu is a herb that I had really great results with scraping cholesterol from arterial walls and reducing that cholesterol plug. It's an Ayurvedic herb. Artichoke leaf is actually a liver herb, so bile helps break down that fat and also helps modulate cholesterol in your blood. And then ginkgo is a circulatory stimulant, so great for cognitive health, and that one can all be combined with blood thinners and so on. So if people come from with cardiovascular issues and they're on medication, I won't be able to use that. Digestive stimulants, basically all of our spices, and I encourage you to use as many as possible. I try to use about 30 different spices. Some of them are mixes in most of my dishes, and things like za'atar and daka and harissa. So you can just buy those mixes, and then by the time you've combined 3 or 4 of those, you've actually introduced 30 herbs into your diet, which is really, really great for gut health because our gut has a very diverse microbiome and it loves diversity in phytonutrients. So dietary considerations. Cruciferous vegetables are the ones that help with that estrogen dominance and reduce toxic estrogen in the body, and there are some supplements made from them. It's probably, if you really have an issue, it's not super practical for you to eat a lot of broccoli. Also, it can affect thyroid health if you kind of overeating it. So, but definitely introduce it into your diet if you have problems with estrogen dominance, and then oxidative stress is also an issue there. So, eat the rainbow. I already mentioned how important fats are. With regards to omega-3s, I actually prefer supplements because it's not always easy to get hold of organic fatty fish. And if it's not organic, you're going to introduce a lot of antibiotics and hormones and everything else, which is in farmed fish, which is actually quite harmful for your body. Heavy metals is another one. So if you need omega-3s, they're highly anti-inflammatory. I'm actually a fan for this reason of supplements. Protein with each meal. That's very important if you worry about your waistline and if you're starting to gain weight during that shift, because it will give you satiety. So protein breakfast will actually really help with weight management. And you don't need to eat a steak or even like eggs if you don't want to. You just can have a protein smoothie, and that will take care of things. Cooling foods, that's very obvious when you're having hot flushes. Raw foods are great, not in winter, not in cold times of the year, not too late at night, and not if you have problems like IBS and problems with your gut. So there's some caveats to that. Mint, cold drinks, all of that is cooling. Tofu is cooling. It actually uses a mineral called shigao in Chinese, which is super, super cooling for the body. But don't overload on tofu. Tofu, of course, is a lovely, lovely phytoestrogen, but it needs to be organic. Again, because it can contain some heavy metals. Soy is kind of known for that. And B, it can also affect thyroid health. So lived in Japan for a long time, and I never ever saw Japanese people like drinking soy milk. They have like a little bit of, so obviously fermented soy natto and then tofu and a little bit of this here and there, but never like massive amounts because they're actually not that beneficial. And for this reason, I strongly prefer herbs as phytoestrogens than foods. But you can, of course, introduce a little bit of that into your diet as well. Coffee, alcohol. Actually, anecdotally, I know some women who just stopped drinking alcohol for those few years, and that alone took care of hot flashes. Just giving up, and I'm only asking for a couple of years. I will have problem myself. I love a bit of wine, but yeah, there are some strategies that can just take care of that with the most obvious adjustment, because alcohol is very heating and it affects liver function and so on. So worth experimenting if you're not a wine lover. The chemicals, very important, because again, they affect liver function and can cause pain in the body and loads of inflammatory processes. And lymphatics really great. When I have my clients in the program, 3 months program, we actually do 1 hour or one session on toxins, and many of them know a lot of things. It's like, what else can you tell me? And I always manage to tell them something that they didn't know. So, for example, a few years ago, I've discovered that parchment paper, it's similar to non-stick frying pans because, the baking paper is also non-stick. So it can have chemical coating. So you might have thought of everything, your cosmetics are clean, you're drinking, I hope, reverse osmosis, purified water, that maybe you did a proper research on what frying pans to use. But then there are other things. And so in our day and age, it's a good idea to have a checklist and go through everything, because you might have missed something that you're using a lot of that can be an easier replacement.
Is that like grease-proof paper?
Yeah, I mean, there are different, on my document, I sent to my clients, I do have a link to like clean paper, but yeah, so non-stick means also that there are some chemicals that prevent food sticking to paper, just like Teflon used to prevent food sticking to frying pans. Well, that's like a small thing, but just to tell you, because every year there are new chemicals introduced to circulation. They're like 250,000 or something, and every year 10,000 new ones introduced. So we need to sort of stay on top of the news flow in that regard. You can see this list is very short because I'm a herbalist, so I only use supplements when I absolutely have to, because I believe our body absorbs herbs much better. And supplement, if people have problems with absorption, you need to break down that peel. So that alone can also reduce their beneficial effect. So this first row is for estrogen dominance. So DIM, indole carbinol, these are N-sulforaphane. These are derivatives of broccoli, but in a little bit more active form. Not always a great idea, especially if women are of reproductive age, or you don't want to push your estrogen too low. So I don't often use DIM. I use maybe some other derivatives that are a little bit softer on the body. Magnesium, taurine, cognitive health, insulin resistance. A lot of it's actually based on Lara Bryden, who is an amazing naturopath from Australia, and sort of a hormone expert. She swears by choline. She claims that it removed her brain fog completely in menopause. So iodine for breast health is very important. But if you have autoimmune thyroid issues, it's absolutely contraindicated. So you need sort of to check if you know you have underactive thyroid, you always need to check whether it's autoimmune or not. In a pharmaceutical world, it doesn't really matter. In a naturopathic world, it matters because it's an autoimmune condition. You will focus a lot on your gut, and you'll treat it very differently to just underactive thyroid. Zinc for vaginal dryness, thyroid health. Laura Brabham also lost vaginal estrogen, and some other bioidentical hormones like progesterone. What else can be done? Move your lymph. So there's content creator called Lymph Queen, and she basically, so she does a lot of lymph drainage, and sort of presses lymph nodes. We actually have lymph nodes deep in the body. We have them in our liver and so on. It's not just the most obvious ones. And so she says that she works with her clients, and just by doing regular lymph drainage 2 times a day, she can completely take care of hot flushes. So it's incredible. I normally use kind of a variety of different strategies, so I can't tell you that this alone will just work, but there are people who just specialize in that thing, and it's amazing for them. So you can obviously move your lymph by jumping on a trampoline, tapping. We have a tapper in the club. It's incredible. Like, it takes a couple of minutes and it's very easy. You don't need to move much for that. Tapping on all of the meridians and lymph nodes and that. Body Balance is a biohacking machine that can do it for kind of lazy people. Or, massage is amazing to move lymph, and it's amazing on so many levels. Healing power of touch, boosts your immune system, detoxifies, but it's not practical to do it every day. And so that's why kind of biohacking can be helpful in that regard. And then, of course, strength training and impact training. Yeah, that's a tapper. Basically, you kind of go through all of your meridians. It's amazing. I have bad posture, so like on the neck, and you can actually work quite strongly and doesn't hurt at all. But I try to go through all of the meridians, feet as well. It takes a couple of minutes. It feels great. Thank you, Dora. The strength training, my mom is like forever struggle, never listens to me, or actually she's on the quest to do the opposite. and then she called some content creator that suggested cranberry juice for something, and she's like all obsessed about it. So basically, she's overweight and has all sorts of issues. And thank you. And then she told me, I swim 1 hour every day and I walk 10,000 steps. What do you want from me? Leave me alone. But actually, that's not the best strategy in menopause, because you need the impact on your bones. Even if you're jogging, it needs to be kind of a pressure. So strength training, impact training, and the combination of it is actually what you need during menopause. And also you want to build muscles. And that's good for blood sugar regulation and musculoskeletal system and so on. Circadian rhythms. Now, I know a practitioner who just uses that, not alone, but as a first like couple of weeks, just doing that, and then her clients go on supplements and so on. So what does it mean? This one thing I always try to do first thing in the morning, to expose myself to sunlight. It's way stronger than any artificial light. It wakes up your pituitary, and it kind of wakes up your brain to kick in, and that's just when people report fatigue. That's the first thing I will suggest them to do. Just align your circadian rhythm with the cycle of the sun. And so, and the same with sunset. The spectrum of light is incredible. So you need all the colors, because they will support your body in all different ways. And actually, it's not practical if you live in the Nordics to sort of go to bed at 2 but in our country, it's okay, because actually at 5 p.m. we should be slowing down, even when we're full of energy and so on. So it's good to have that ritual with the sunrise, and then kind of start slowing down on the day. Look, bluelight.co.uk is the glasses that you can basically wear, and they give you different colors throughout the day. So towards the end of the day, you wear orange glasses and then pink glasses and so on. They're not suitable for prescription glasses, because you're just not going to see that well. But I mean, I prefer to expose myself. Well, I can't really, I'm not so good with sunrises, but at least with morning sun and then sunsets. And so what she does, she sends people to the park, sunrise and sunset, and incredible results. Inflammation, joint pain, mood, just from aligning yourself with the energy of the sun. How great is that? Doesn't cost any money either. The intention setting, I will talk a little bit about that in hypnotherapy just in a few slides time, but yeah, maybe it's one of the most important things. Maybe I'm biased because I love somatic healing. Acupuncture and then biohacking coming up. Case. So very quickly, I'll go through this case. It was quite interesting for me. It was a 47-year-old yoga instructor. What was interesting about her, she was doing everything, right? She would meditate, she would do yoga, stretching. She was also gluten-free, dairy-free. She did have Hashimoto, so that was a correct thing to do. And then you meet a person like that, very holistic person, you think, well, how can I help you? You're already kind of doing it all, right? But then when you go systematically through every aspect of your life and you apply all of your knowledge from different angles, actually magic happens. So I prescribed some of the herbs that I already kind of described to her. Main concern was sort of PMS type symptoms and anxiety, which of course you can sort of experience outside of peri, but they heightened. So they became really uncomfortable that she decided to seek help. And that's the sign of the menopause. It actually magnifies whatever's been going on chronically. Because your body is dealing with hormone shifts, it would magnify those symptoms. And that's why it's so important to take care of them during that time. It's one of the most important times to invest in your health if you want to sail through menopause. Just take care of those chronic imbalances because your body will struggle. It can be doing really well maintaining homeostasis when you're young and full of energy, and you can kind of live with those symptoms, but then they can fall off the cliff. So basically, I gave her some adaptogens. I gave ashwagandha. Cholis is for thyroid health. I also did homeopathy. CP is one of the main remedies to actually support menopause and perimenopause, but it really symptom specific. Can't remember why I suggested grounding, and then we work with sleep hygiene. Sleep is one of the most important time. Well, it's the most important time in the day for repairing your body, restoring, and all the healing happens when you sleep. So the quality of your sleep is very important, not just how long you sleep, but how long is your deep sleep. You know, if you have aura rings, should be 1 hour, 1 hour and a half at least, because that's when your body really resets. And sleep hygiene before you go into sleep, very important. And then, so she was already dairy-free, gluten-free, and we did a medicinal smoothie with protein and fiber, and a few other things. I put her on resveratrol. That's another supplement supportive for estrogen dominance, which helps liver function, push it towards healthier type of estrogen. Calcium diglucarate was another one, and multivitamins was high B's for kind of cognitive health. Actually, it's not after 1 month, after 3 months, but after 1 month, I was looking at my notes and it says no result from herbs. And then other lines, anxiety better, sleep better, mood better. I was like, what is going on? It actually happens quite often. Patient comes after 1 month and they say, don't really feel anything. And then you go down your questionnaire and say, well, how's your anxiety? Oh, it's a little bit better. And how's your sleep? Yeah, I think it's kind of, so basically there was an improvement, but not significant enough. And that's how it is. Herbs are very gentle and your body needs time to rebalance and you won't feel it overnight. But in 3 months, she had really, really great results, better energy, better moods, anxiety improved, and so on. So holistic approach in her case worked really well. Now, one of my favorite topics recently, biohacking. We're going to have an event on biohacking because I launched kind of a second phase with some new devices that I'm super keen to introduce. I won't focus too much, but I picked 6 that I think are great for this transition. Fine thread therapy. For me, it's all about organ rejuvenation and mitochondrial function, which is the energy of the cell. So if you have great energy of the cell, then because the body heals you, it corrects all the imbalances. So basically, you give body that energy, and then it does everything else for you. So that's probably the most important function that you need in order to stay in balance. And fine thread does that. Vagus nerve stimulation is about your nervous function and about so vagus nerve that helps with maintaining this balance between sympathetic and parasympathetic mode. So parasympathetic is our rest and digest, And again, if anyone wears Oura Ring or checks your HRV in some way, which is heart rate variability, you sort of basically want to be able to switch quite quickly, parasympathetic, sympathetic. You don't want to stay in sympathetic stress mode for too long, because then a lot of health imbalances will happen. So vagus nerve stimulation helps with that. Brian Johnson loves this device, just in case. There are some fans. And then but you can also do it with hot and cold therapy. So like a cold plunge and a sauna combination that we have in the thermal suite. Because again, it's that switch. I'm stressed and scared for my life, or I'm relaxing and everything is great. That helps to train your system not to stay for too long in this kind of fight or flight mode. So some other strategies there. Hydrogen inhalation, that's my sort of latest favorite toy. I actually have a funny story. I went to Health Optimization Summit a few months ago, and I had some devices I was interested in, and so I was checking them, talking to the founders and all that. So I got a few of these. I got the machine. My husband is like, "Why are you spending all this money? You got so much already." He's normally supportive, but I spent his maintenance budget on biohacking again. And so the team was like, "We do hydrogen water. What does it do on top?" And then we listened to the talk of the founder. And basically, so hydrogen is the super important antioxidant. It helps with oxidative stress, which means it's anti-aging, but also it's kind of selective. So you can't have too much of it. Because if you take too much, for example, resveratrol, at some point it just protects your cells, but if you take too much, it can start kind of hurting your cells, because it starts binding instead of free radicals to healthy cells. So you don't want too much of a good thing in this case. So anyway, hydrogen doesn't do that. It also a very small molecule, so it crosses blood-brain barrier. So it's a superoxidant for me in this sense. And water is great, and we're going to do a talk on water next month, and how hydrogen water can support. But basically, because we ingest it helps with the digestive system. It is systemic, but you know, if your digestive system needs more support, that's where it ends, right? So when you inhale, it basically supports your lungs as the first point of entry, and then it also supports your brain. So they have great results with long COVID and coughs and COPD and loads of different lung conditions, also with autism. So they have headphones where you can go kind of through your ears. They have goggles where it goes through your eyes, so for the eye health. And so my husband comes home yesterday and he said, "Oh my God, I feel so great. You know, I did not have brain fog, but actually I now feel like I did have it, and now it's over." So basically, he now after the training from that company, he now spends 1 hour on the computer inhaling, you know, hydrogen. He's over here so he can testify before he goes home.
Yes.
And you know, my staff now is kind of fighting for it, so that they can use it before they go home. And basically, yeah, biohacking, you need to do a little bit of research to learn about it. But you know, my passion is about the devices that cannot hurt you. So like hyperbaric chambers, cryo chambers, they can send your body in the overdrive. That's why they are great for you know, certain medical conditions, but they're not safe for everybody to use all day, every day. And you really need an expert to say, okay, you should do that, or you shouldn't do that. And actually, if you have hyperbaric chamber, because oxygen is oxidizing. So when you have a lot of oxygen in your body, you might want to do hydrogen afterwards, so it can bind to some of the free radicals and you know, can balance your system. Again, cryo is something that is great in summer. In winter, our body is overly cold. So again, look at your energetics and think whether you need it or not in winter, and great for injuries and so on, but not for everyone, like I said. Lymph drainage, I already mentioned, detoxifying, hot flashes, cellulite, things like that. LED helmet, if used regularly, it can actually reduce hair loss, and it can stimulate. So I have people who've been using it regularly and reporting great results. This is coming next months for sort of pelvic floor tone and urinary incontinence, which, let's face it, if you had babies, might be an issue. And also, if you didn't have babies in menopause, you know, these muscles relax a little bit. When you sneeze and laugh and all of those accidents might happen. Yeah, so this is something that one of our doctors in our clinic is very passionate about, and so we're going to be introducing it to our range. So I'm finishing now with the menopause mindset. This is super important because if you look at work of medical anthropologists who study different cultures and different symptoms of different diseases and try to understand why certain cultures don't experience or there's no occurrence of certain diseases there and what factors positively influence their well-being. So they look at, for example, traditional cultures that where women don't have uncomfortable symptoms of menopause. In fact, in many cultures, that language doesn't exist. There's no word for hot flashes. There's no word for menopause. And so kind of women sail through this. And I'll mention some of the positive factors in a minute and why this happens. But your mindset and looking forward to it rather than being scared by it is so very important. So Lisa is noting here, she's got an amazing podcast, Menopausitive, and speaks to a lot of inspirational women. So if you want to have this set shift, listen to some of her talks. And because nature is not cruel, it's not actually meant to torment you, and body is not your enemy. It is producing certain symptoms for you to give you a clue. Okay, something's out of balance. I'm going to make you tired to tell you that you need to rest so that I can go back to homeostasis. So this is something I focused on in my work actually this year, working with patients, looking at their symptoms and thinking, what is the body trying to tell you? And I want to mention frozen shoulder that happens in menopause. I actually had a patient with a frozen shoulder who has been in a lot of anti-inflammatories and they're not working, and she couldn't brush her hair and dress herself, so it's quite uncomfortable. And actually, we use psychosomatics and hypnotherapy to help her realize that she put too much on her shoulders. And then once she floated herself, the pain went away. It was crazy. It was just like 3 months of work and she was pain-free. So your body is really helpful like that. If you're intuitive, it is trying to tell you something with symptoms. So don't fight them, don't numb them. Try to understand, what are they telling me? Because there's always a clue how to make you happier and healthier. And you know, in traditional societies, women are looking forward to menopause because they become real matriarchs. You know, they come into their power, they get respect from the society, they become free of some kind of duties and things. And that's actually a time of empowerment for those cultures. We don't really have it in our culture, unfortunately, because we place so much value on women being fertile, you know, and productive and beautiful and all of that. And that's how we value ourselves. So it's up to us to actually reverse that and empower ourselves, because our society is not quite doing it at the moment, but people like Lisa are there to help you with this transition. Also, don't pin all your symptoms on menopause. So I have patients on hormone replacement therapy who are still, you know, suffering through some of the other imbalances. And that means that it's not all about estrogen and progesterone. There are other things that can be happening. So again, holistic approach is great. So menopause absolutely is a time of renewal, and when we're becoming incredibly valuable due to our experiences. You know, how many more things I know now compared to like 20 years ago, how many more people I can help. You know, we need to see value in this, and I'm sure all of you have those experiences that make you incredibly valuable, you know, because you have few more years under your belt. So these are the lessons from Blue Zones. And what are those people doing in traditional societies that don't have hot flushes and the rest of it? They do it seasonal on whole diets, obviously. They actually still walk barefoot, so they do the grounding. So all of this EMF, we actually have this quantum healing device that you can try today, later. that helps you to massively to offset 5G and EMF and other exposures. It actually also rebalances your energy in a way that I can't explain. It's called quantum healing. So the company actually doesn't disclose it, but they check before and after your organ function, like blood analysis and so on. So the results are fantastic. Yeah, but grounding is massive. You can do it obviously barefoot in a park in our culture as well. Movement is very important, not just going to the gym, even like every day, once a day, but moving throughout the day. So those women in Japan, you know, they're gardening, they're picking things up, because in Japan, people still do a lot of things on the floor, right? They sit on the floor, sleep, they have to take the bed away, put the table, and sort of multitask in this way. So they stand up and sit down a lot of times during the day. That's really great. Belonging and community is very important, and spiritual connection and purpose. And I actually do some work with some of my clients that want to find that purpose in life, right? Because once their career kind of is over, they need some inspiration. What else I can do? So what I do is suggest them to put 10 things in their life that brought them the most joy. So their happiest moments in life, right? So they write this list, and then they kind of add some sort of characteristics. Was it beauty of nature? Was it an achievement? Was it family related? You know, was it health related? So they grade all that. And actually, I've done that exercise. So I put like 10 best moments in my life, and then what came out for me, they were all, not they all, but the biggest score was beauty of nature and community. And actually, I looked at my life and I realized that I spent most of my life achieving things. So, and actually half of them had to do with my career in finance, which is now sort of less relevant. Although one patient asked me to give him financial advice during consultation a few weeks ago. Maybe we'll launch financial wellness at the club. I don't know, but you know, so spending all life achieving. Actually, my mission was about community and nature. So I'm actually aligning with it, being with you. This is the community part. I'm still trying to achieve things in backgrounds, just can't completely switch it up. But actually, I'm doing that by learning, and learning is good in old age because, you know, it keeps our brain functioning. So, you know, and there are many women who actually sail through menopause and rediscover themselves. And I know a lot of these women. You know, there's Alicia Anelli, who's a content creator, and she does clean beauty while wellness junkies. You know, her page is amazing. We have a client who's a fitness instructor, and she helps with strength training and so on. Francis, and we have her details if you'd like to find out. She's really great, helping with kind of musculoskeletal and so on. So these women started new chapters in their lives, completely rediscovered themselves and really enjoying it. And you know, I turned 50 years old a year and a bit ago, and I was not happy about it. I didn't want a big party. I went with a couple of my close friends and my husband deep into Siberia. I was basically hiding, right? And now 1 year and a bit later, I have a longevity lounge. I have all this biohacking. You know, I'm my first kind of specialty is herbal medicine and hormones and fertility, and that's it. But now all this new world opened in front of me, and I'm helping all my friends and family. So I got so much inspiration already from aging, and also I'm just studying this. Well, I plan to this amazing facial beauty technique from Russia, which I've never heard of in this part of the world. So we'll do an event on that. So this is kind of one of the examples where, you know, you start to rediscover yourself, and this whole new world opens up with tons of inspiration. So I really want all of you to look forward to that, because women will be free. They will have so much experience and wisdom to benefit from and spread it around to other people. And yeah, and please tell others how to and inspire others to change their attitudes. And yeah, I think that's all from me. I've ran over a little bit, so maybe Mona and I will hang about. You can ask questions after the event. but Jana will tell you about some kind of gifts and things we're doing just straight after. And thank you so much.
Thank you, Jenya. Thank you, Mona. You're hiding. Come back in here.
Oh, sorry, and we've got Olga as well, who created a menopause aroma blend here.
The Menopause, there's a different blend for women. It's just a full shaken.
Okay,
And we have we have course called Women's Health, and all the estrogens from claritage to lavender to it's all there. So what I like about you that you take your things internally, you have a whole product for other things. But with aromatherapy, you can just have massages with it if you want to have it. You can put it into your diffusers like this. And you don't need anything water, nothing. You charge it for 3 weeks. And you can put it inside in the diffuser. So Jenya is actually selling those things here. And it really made a big difference to my life when I started doing it. Because this is very quick emotional regulation on the go. When you go in, limbic part, epicenter of memory, emotions, and hormone. So when the sound travels into the little brain, you straight away start deregulating yourself. So if you want to have a wonderful calm sleep, induce yourself into the calm sleep, you can have a breathing practice. This a little bit, like a few minutes before you sleep. You can put in your magnesium Epsom salt bath. If you want to boost your brain, remove mental fog, you can have a focus blend because it's massive do that, especially when you have zooms, very effective, easy life. So anyway, there are many blends. You can try it, and they are magic. And this is one that has awards, another one. So
yeah, it's an award-winning brand. We're going to be using it in our saunas as well, and you can come and check them out later. Great. So, Jana, very
There's some offers, some gifts for you today, and quite a big offer as well. The sort of the immediate gifts, the quantum healing device. You're welcome to come and try it. You place your palms in it for about 15 minutes. Alternatively, you can put a piece of jewelry in it, leave it for 2 minutes. And what it will protect against is with our mobile phones, with the Wi-Fi buzzing around, with all of our devices, it really helps protect the electromagnetic field. So really worth trying. That's device number 1. Device number 2, Paolo's new favorite, the hydrogen therapy. Hydrogen gas, as Jenya said, is a huge, the smallest and most powerful antioxidant. And they actually use it in Japan in hospitals. That if you've had anything with brain or cardiac events, really helps up speed up that recovery. Also, as Jenya mentioned, lots of day-to-day use as well. 15 minutes of that. And try it. The helmet over there, let's pick that up. It's a funky little gadget. Put it on, and it glows, and we put it on, and that really helps stimulate hair growth. There's studies with Harvard Medical School, and they've actually proven that the red light will now start to regrow the hair. Also with brain fog. They're really great little device there. So 15 minutes of that. Welcome to try.
can you use it if you've got like highlights or dye?
Yes, absolutely no problem because it's a cellular. It sort of goes deeper than that. So good question. It's more about blood flow reaction. So we've got these for you to try. I think Ryan or Karen out there will take this, or it's first come first served for the 3 pieces of kit. Now the bigger offer than that, as you've seen, Jenya has put up some of our various bio devices, the red lights. We've got a whole plethora. We have a membership. It's a minimum of a 2-month. We would normally have a joining fee of £250 to join the membership. Today, and I was told today only, we are taking away the joining fee. So you're welcome to come. There's one membership. It starts at £250 a month. What that does, it gives you 4 treatments that you can select between. I have a little flyer over there which will show you what the treatments are and what they do for you. And then in conjunction with that, you're welcome as confirmation to come and use when you have a treatment at thermal suites at the same time. So that's £250 a month, 4 treatments, and we sort of go up and on from there. A very special offer from Dr. Mona. She is offering 40% off her first consultation. So take advantage because it's so nice to have a woman that is so experienced in that field and really specialises in that. So, you know, when we go to an NHS GP, what do we get? 5 minutes? You say antidepressants at the end of it. Maybe.
You're lucky.
And also Mona is very hardworking, so she works on Saturdays, which is great to have a GP, especially if you have little kids or someone who needs kind of urgent consultation. So she's here on Saturdays in Notting Hill, so you also don't need to travel too far to Harley Street and so on. Just great.
Yeah, I mean, you live and breathe what you do as well. We spent some time in the staff room and
An hour, like an hour.
and the amount of tests and things that she's got at her disposal that we can literally check and do everything is absolutely astounding. So a real source and pleasure to have her with us. So thank you. And Jenya, you've got an offer if people would like to come and see you as well.
Yeah, so for today I'm just going to give to you biohacking with an initial consultation, but
The biohacking is normally about £95, so that you're giving,
Yeah.
I think it's the use of the helmet, maybe the NeuroSim, that's really great. I use that in the office all the time, brain focus. Okay, I think that's
hey,
it.
thank you so much.
Thank you very much for coming.